Hey there, Lifespans class. This is Dr. Aang. Checking in with you for week 3. I want to welcome you to week 3. And I've had the pleasure of going through your introduction posts and getting to know you and some interesting facts about you and your goals and your aspirations. Those are very inspiring to be able to read those posts, so I appreciate you taking the time to do that. Now we went through week 2 where we went through infancy and trust versus mistrust. I've had the pleasure also of going through those papers. Grades will be released soon on those. I'm about 3/4 of the way through grading those. And a few things I want to point out. Remember, it's APA formatting style, so if you're not familiar with that, you might want to consult the Writing Center. They're super helpful there. And you can submit your paper. You put the content in, you can submit it to them. Then they can help you get it in that polished scholarly package of how we'd like to submit our assignments at this level. So that is part of the grading rubric. So I do hope, don't just focus on the content, but also on the delivery of that submission. That's kind of pinching a few students. The content's good, but just we want to package it up as professionally and scholarly as we can. So, week 3, as we move into now, we went through infancy, now we're looking more into the stage of toddler, which is around 18 months to, some say for sake of this course, to age 3. So 18 months to age 3, it's the toddler. And we go through, you can see chapters 5 is going to focus more on the cognitive development. So again, looking at Piaget's, and then of course Erikson's for sake of the reflective paper that you're going to submit Sunday. And we'll go through that, the cognitive stages. Then we're going to move over, chapter 6 focuses more on the social development of the toddler. And specifically, when we think about Piaget's and we're thinking about the sensory motor, we think about the infant, and a good example of this, moving from the sensory motor to the pre-operational stages. So sensory motor is more when they see an object, they put it in their mouth, they know that it tastes good, so they continue to do that repetition, or they want a pacifier, or they want their food, whatever the case may be, so they continue that through repetition. It's not reflexes as much as now it's more just reaction to the behaviors will match what they, if there's a perceived reward, then that will precipitate the behavior. So as they move though from the sensory motor of just the action taking place without the cognitive connection of the cause and effect, we'll move more into the pre-operational where now as a toddler they're going to know that is milk, or that is water, or that is whatever they call their pacifier. They can link more a name to that. So they're starting to connect the dots a little more as we move into that pre-operational stage. And that does continue on up into preschool stage. So they are just tipping from sensory motor into barely tipping into the pre-operational stage. So we'll visit that a little bit more as we move in next week to the preschooler as well. But the one to focus on, again, is we want to look through Erikson's lenses. And if you, I haven't mentioned this before, but this is obviously our textbook here. If you look in the chapters here, you're going to see some tables that are going to be helpful for you, as well as some examples with that. So make sure you're consulting that textbook. You can reference that as well as you study. And then as you're going to be taking the exam, valuable resources here. is especially reference this as you're writing your reflective papers. But Erikson's, so autonomy versus shame and doubt. And what does that look like for a toddler? This stage is autonomy is going to be, as an infant, the infant relies for their needs and safety primarily on the caregiver, whoever that is. That is going to be where that trust and mistrust is developed. In infancy, it's going to be linked directly to that caregiver. But as we transition into the toddler in autonomy versus shame and doubt, now the child is going to start to think, maybe I have some preferences here, or maybe there's certain things that I like or dislike. And not only are they going to think that, they're going to start to act out on that. So we see the toddler is the one that can throw the fits. They're going to find out what works and what doesn't. They're going to test limits to see what it takes to get what they want or their preferences. So some safe, healthy boundaries for the toddler would be ways that they can establish that autonomy in a safe manner. Would be things like picking out what they want to wear, picking out what they want to eat. If there's certain toys that they like to play with, maybe they don't want to follow directly in their older siblings' footsteps, and they want to exercise a little of that autonomy themselves. A big stage that we hit here is going to be toilet training, potty training that takes place here. Is that supported with patience? And do they feel an overall sense of support and encouragement? Or is there shame and disgust and impatient behaviors and just overall frustration from the caregiver? They will definitely absorb that as well. So that's a big hallmark sign that we see for a toddler when establishing autonomy versus shame and doubt. So giving them time and giving them choices. So if you give them a choice of what to wear, and then they now struggle with, no, I don't want you to put it on me, I want to put it on myself, and it takes them 3 times as long, is the caregiver going to rush in and take over because they're so frustrated that the toddler's taking so long? Or are they going to exercise that patience and support the toddler as they're seeking that autonomy and that little bit of independence in this stage? So those are some highlights of this. Also look as you move into chapter 6, as you're reviewing those PowerPoint slides, just kind of focus on their social interactions. Watch the child as the child will, as an infant, they just pretty much play by themselves. They seek satisfaction from cause and effect, just very simply, without a lot of cognitive connectors. They find if they like to stare at a mobile or an object hanging above their crib, if they like to grab a toy and put it to their mouth. They just know that brings satisfaction, so they'll have a repetitive behavior there. Now the toddler's going to start to look more into that, to explore more. They're going to find out what things that they like and what things that they don't like. They're going to move more into that stage of exploration. And this is the child that would like to dress themselves, and it may not look the way that the caregiver would prefer. So just giving them that support and that guidance. And to avoid the frustration, maybe, do you want the blue glass or the red glass, and giving them choices? Maybe not saying, what do you want to do? Because they may say they want to go ride their whatever, their tricycle, their ride-on toy in the street. So maybe you don't give them the option, open-ended option, but you say, would you like to go in the backyard and swing? Or would you like to go into the playroom and get your markers out and draw a picture? You give some options, but you're making sure they're within the guidelines of safety and what you will allow for that child. So again, Chapters 5 is more cognitive development, and then chapter 6 moving into the social development and finding out that still at this stage the children can play side by side and not necessarily interacting with each other. And then just knowing at what stage do they start to realize there's gender differences? At what stage do they form attachments, which they have obviously through trust versus mistrust, but that's based off of if their needs are met. But pay attention to that as you move as well, is those attachments and how are they formed, what are their social interactions. But that gives an overall view of the toddler in this stage, Erickson's versus autonomy versus shame and doubt. Again, reflective papers are going to be due Sunday by midnight. And if you look at the schedule, we're looking at September 20th is when the first exam will open. So we'll have one more week before that, but have that on your radar that that is coming. Have office hours that you can schedule at any time if you want to come in and discuss any of the assignments. But overall, if you don't hear directly from me, assume that you are doing fine. Well, when the lights just went out. But take care and reach out if I can do anything for you. Thanks. Bye.